So alcohol enters the baby's bloodstream 2 different ways. It's so sad, right? It's scary. So alcohol can enter the baby directly through the umbilical cord, right? Because the mom and the baby share the same blood supply. So the alcohol that the mom ingests crosses through the placenta, enters the baby's bloodstream through the umbilical cord. It can also pass via diffusion into the embryonic fluid. So that's why I say that you can really consider that all parts of the fetus are being exposed, externally and internally. So it's surrounding the baby in the embryonic fluid, it's getting through the placenta, it's getting from the maternal circulation, it's exchanging through the placenta, it goes through the umbilical cord to the baby's circulation. So the key thing to know is that a pregnant woman never drinks alone. Every little bit that you put in your body is pretty much shared with the fetus. And it hits particularly home now because, again, because my wife's pregnant, and we talk about all these things. I mean, it's crazy. You cannot do anything when you're pregnant. It seems like. I mean, you can't eat anything anymore. You certainly can't drink, and you can't drink ahead of time. They really recommend less caffeine, and that's because you share everything with your baby, and it's hard. It's definitely challenging, but you really have to do it if you want to have a safe, healthy baby. So babies lack the liver enzymes to metabolize alcohol because their livers aren't fully developed. We'll talk a little bit about what the maternal liver does to break down the alcohol. So the baby relies on mom to break down all the alcohol. And so based on half-lives, if you have a beer in the mom's system, that's going to leave a residual amount of alcohol in the baby's system for up to 3 hours. So just based on how the half-life of alcohol is, about 3 hours of exposure for one alcoholic beverage. So there's really not a safe amount, right? Because there's always going to be a little bit of exposure. So when the question comes up, it's probably safe to have a glass of wine, right? Or that's what we read on the blogs, or what people might say, pregnant friends might say. It's probably safe to have like 1 glass of wine, right? My body can handle it. It'll take care of it. The baby won't see it. Well, in actuality, the baby does see it. They're going to see it, and they're going to see it probably for about 3 hours. There's going to be a little bit of residual alcohol in your system that, while it may be safe for you to walk around, carry on, the baby's still going to be experiencing the residual alcohol. And so what does that do? Well, we talked about the cellular toxicity. The way that it does that is high concentrations of alcohol can actually induce cellular necrosis, which is good if you're trying to clean a table. If you have norovirus on the table, if you have flu virus, pouring alcohol or using those alcohol wipes on your hands is really good. You have a high concentration of alcohol that you're using to kill a cell. But when cells are dividing in a fetus, that's obviously a bad thing. It can also activate the apoptotic cellular cascade. So you have cell necrosis in high concentrations. Lower concentrations, it can actually induce cell death via apoptosis, so it's a little bit slower. But the 2 different ways that cells die, it actually works in both ways. High concentrations, you get necrosis. A little bit lower concentrations, you can still have cell death, and it's via apoptosis, so it activates both. The way it does that, it's a small molecule. And you remember your lipids, you've got the kind of lipids on both sides. Alcohol is a small molecule, it's water soluble, it can diffuse through and kind of push out some of those lipids. So it kind of breaks up the surface, the surface of the cell membrane. When it binds underneath, it can actually push out some of those important transport mechanisms. It can push out some of the ways that cells know to get to different places. That's kind of the second phase of it, right? If it doesn't directly kill it via apoptosis in low concentrations or necrosis of the cell in high concentrations, it knocks out important transport molecules. And so then the cell doesn't know where it's going if you do that. Not only that, alcohol is actually a free radical scavenger. It's not a free radical scavenger. It actually releases free radicals. So free radicals are bad because they put a lot of pressure on the cell. When there's free radicals around, the cells tend to kind of break up and die. They're small reactive molecules that damage fat, protein, and DNA. So when you drink alcohol, you're actually increasing the oxidative stress on the body. Your body can probably handle it. The baby's body obviously can't, and that's why they get fetal alcohol syndrome, another mechanism. So if it survives all of these things, if it survives the initial insult, the high concentration that leads to cell death, if it survives the bursting of the cell membrane and pushing out all those transport molecules, there are still ways that alcohol causes bad things on developing cells. So if you survive the initial hit, it actually changes the function and expression of GABA molecules, which is particularly important for what system? For what system? The nervous system, right? Sorry, I gave it away. So when you change the function of GABA, you get this excitotoxicity. So in kids, they kind of, or in developing neurons, it actually causes you to spring out and overexcite to the point of death. So you can see here, these are normal neurons. These are the neurons of cells that have been exposed to alcohol. And this was in vivo. So they make inappropriate connections, and that's the basis for some of the behavioral and cognitive effects of fetal alcohol syndrome and fetal alcohol spectrum disorder. So we talked about this a little bit already, but free radicals can destabilize all parts of the cell. It can destabilize the mitochondria, and of course the mitochondria are the workhorse of the cells. So again, this is the second hit that we talked about. You get the first hit with the high concentrations. You get a second hit with some of these free radical issues that destabilize the cells. You get the third hit with the altered expression of the growth factors. So the alcohol pushes out some of these signaling or these cell membranes that are really important for the signaling, intracellular signaling, and that can impact the way that the cell develops and the way that it grows. And here's an example of some of the cell adhesion molecules that are affected. So of course, you have the cellular adhesion molecules that bind to extracellular adhesion structures or to other cells, and that helps them get to the right place. So it's kind of like the street signs. If you take the street signs away, how are they going to know where they're going? And so they migrate incorrectly. Additionally, the mom's enzymes that are really important for breaking down alcohol, the one that's really key is ADH, alcohol dehydrogenase. Does that sound familiar? Alcohol dehydrogenase breaks down alcohol into acetaldehyde and free radicals. And those are the molecules that the liver then is able to break down further and excrete. ADH is also extremely important in the baby's metabolism of vitamin A, babies and moms. Retinoic acid is a really particularly important molecule for the development of the eye. So retinoic acid is vitamin A, right? It's an essential vitamin. It's necessary for growth. It's very necessary for eye development and proper immune system functioning. And so if you remember from the face, there are a lot of issues with the eye. A lot of kids that have fetal alcohol syndrome actually require multiple eye surgeries to have good vision, and this is thought to be why, because of the issues with vitamin A. So, is it safe to drink in pregnancy? Is there a safe time? Not really. If you're going to get pregnant, you should stop drinking 1 to 2 months before you're going to conceive. That's because you just don't know when conception is going to happen. Now, there's a theoretical time where it's probably safe. The problem is you don't know when you're going to get pregnant, when the baby actually, or when the embryo actually forms. So theoretically, you will not have exposure to alcohol before the embryo is implanted, because there's not that connection yet, right? The embryo is not implanted in the uterine wall. There's not a bloodstream connection between what mom's doing and what baby's doing. But again, you don't know when that is. So the general recommendation is if you're going to try and get pregnant, it's a good idea to stop drinking about a month or two before trying to conceive, because you don't know when the clock starts. And once it's started, alcohol can affect any organ system. And so, if it's organogenesis period, then you're going to be hitting the cells that are dividing, say, for example, the liver. While the liver's dividing, if you're exposing the newborn liver to alcohol, then those cells are probably going to divide and migrate inappropriately. And so same thing goes for the entire process, for the entire kind of embryogenesis. Now, alcohol affects us too, adults. It's a legal drug, and used in small quantities, it's probably totally fine. And some studies say, low quantities of, red wine, for example, might decrease your risk of heart disease. But the key thing is using in moderation and knowing the amount of alcohol that's considered one drink or a safe amount is really important, because a lot of people overuse the drug. So alcohol for you and me. Well, chronic use can cause a lot of complications. Can you name some of the organ systems that are affected? Same systems in adults as it is babies, actually, if you think about what happens to a baby.
Nervous system.
Yeah, exactly. So what do you think happens to the nervous system?
Cell death.
Mm-hmm. Good. Good. What else? What's the key? What do people usually die from when they're alcoholics?
Cirrhosis of the liver.
Yeah, cirrhosis of the liver. Exactly. So cirrhosis is hardening, right? So it causes the liver to kind of shrink down, become fibrotic. Eventually, if the liver doesn't function, you get a lot of complications. You get varices. So the liver is what kind of screens the GI tract, all the toxins in the GI tract, and then shunts blood from the GI tract back up into the circulation. So if you have a hard liver, it's going to be hard for blood to get back through the liver, back into systemic circulation. So you develop these varices, right? You develop connections between the portal system and the systemic circulation, ways for blood to get around the liver. That's why people that are alcoholics, they have varices in their esophagus, dilated veins. They get hemorrhoids. They get the caput medusae. Have you read about that? That's like the blood vessels around the stomach, or around the umbilical cord. So those are really bad. Varices bleed really easily. If you have a variceal bleed, that's a tremendous emergency. You could die very quickly if you have a variceal bleed. We talked about the brain a little bit. Why do you think people have encephalopathy when they're alcoholics? Why do they get encephalopathic? Do you know what encephalopathy means? So it's a severe altered mental status. So somebody is like functioning, and after years of drinking, they become confused and altered, and they don't act right. They do silly things. They don't walk right. So the liver takes the toxins from the GI tract, and it decontaminates the body and protects your brain from circulating toxins. When the liver doesn't function, you get high levels of circulating toxins. Ammonia is one of them. Ammonia builds up in the system and causes you to become encephalopathic. Okay? Pancreatitis. So pancreas can actually become really inflamed. It's fairly sensitive to high doses of alcohol. So the common complication we see in the ER before somebody has really severe end-stage liver disease is actually pancreatitis, where drink heavily, have 10 drinks for a week, and then you come in with a lot of abdominal pain, a lot of vomiting, nausea. We check their blood work, and the lipase, which is a sign of pancreas kind of squirting out its enzymes, is like 10,000, for example. So that's pancreatitis. Very, very painful. Have you ever seen anyone with pancreatitis? It's extremely painful. People look really uncomfortable, and it can actually kill you. Pancreatitis has a mortality rate of around 10 to 15%. And then a more common, seemingly less benign, is gastritis. So people that drink a lot tend to have a lot of heartburn, and that's because alcohol can really increase the acid production in your stomach, and it just burns. It just feels really uncomfortable. Probably is not going to kill you, but it's not fun. And then, of course, acute use has a lot of social implications. So people that get drunk in bars tend to do silly things, wind up in the emergency room on a Saturday night, or they just drink too much and pass out, and that's not good either. So key thing is moderation, right? But then long term, we talked a little bit about what it can do to the liver. And the way it does that is by increasing collagen and elastin. It does that in the uterus, so it's particularly good for women to know that actually long-term chronic alcohol use can decrease fertility. So that's why we counsel women, if they want to get pregnant, it's probably a good idea to drink in moderation and to not drink the couple months ahead of time. If you go back to drinking heavily after the baby's born, it can cause issues with breastfeeding. It decreases milk letdown. And then it can also reprogram the mom's hypothalamic pituitary axis, and it can increase glucocorticoid secretion. So that can impact mom's health and also baby's health.
I have a question.
Yeah.
So, like, if a woman is planning to get pregnant and then has the baby and then wants to breastfeed, how long can she not drink alcohol for?
In general, there's not as much transmission of alcohol into the breast milk, but it probably takes a good 3 or 4 hours for a drink to kind of not be in there. Does that make sense?
Yeah.
You know, people drink again. You know, a lot of women drink again after they've delivered the baby, but usually it's social and it's appropriate. So if you put your baby to sleep at 8 o'clock and you have a glass of wine before you go to bed, it's probably not, you know, there's probably not going to be any breast milk by the time you're breastfeeding at 2 in the morning.